Hello, my name is Lynn Paulson. I am an Indiana State University nursing student. My population at risk are pregnant women who smoke during pregnancy and the effects of secondhand smoke. By the end of this presentation, you should know the risks of tobacco use in pregnancy on the mother and unborn baby. Be aware of problems that smoking during pregnancy can cause for your infant as he or she develops. Be able to dispel the myth that electronic cigarettes and smokeless tobacco are safe to use during pregnancy, and identify the benefits of smoking cessation prior to pregnancy or in the beginning months of pregnancy. At this time, I'll ask that you take the pre-test before moving through the presentation. Cigarette smoking kills more than 480,000 Americans a year. It's no secret that smoking cigarettes and using other forms of tobacco are addicting and cause cancer, but many don't know the harms for the woman trying to get pregnant and to her unborn child once she gets pregnant. Health risks for smoking in pregnancy include an increased risk of infertility by affecting fertilization, implantation, and even ovulation. Smoking also increases your risk for having an ectopic pregnancy, a pregnancy that occurs outside of the uterus, usually in the fallopian tubes. This is because women who smoke have a higher level of protein in the fallopian tubes, which prevents the muscles in the tubes from contracting. The contracting motion is needed to transfer the fertilized egg from the fallopian tube to the uterus. Women who smoke are at risk for having a stillborn. Smoking during pregnancy results in more than 1,000 infant deaths annually, according to the CDC. This is because the toxins from the smoking gets into your bloodstream, and that's your baby's only source of oxygen and nutrients. Women who smoke in pregnancy are also at an increased risk of premature rupture of membranes, which is when the amniotic sac ruptures too soon, placental abruption, where the placenta becomes detached from the uterine wall, and placenta previa, where the placenta covers the opening of the cervix. Risks to babies whose mothers smoke during pregnancy include premature delivery. A pregnancy under 37 weeks is considered premature. Baby's lungs aren't always developed. This increases respiratory problems. Baby can end up on oxygen in the NIC unit, have to stay in the hospital longer, and then just have increased risk for problems down the road. Babies are at an increased risk for low birth weight. They can be small for gestational age. In utero, which is intrauterine growth restriction. That's because baby's not getting oxygen and nutrients through the placenta, so baby stops growing. There's an increased risk for tissue damage to the lungs and brain, physical deformities like cleft lip, cleft palate, or both, and babies whose mothers smoke during pregnancy are more likely to die from sudden infant death syndrome. Secondhand smoke. It comes from the burning end of a cigarette and the smoke exhaled by smokers. It contains more than 7,000 chemicals, so it is not risk-free. What can you do to protect yourself? Don't let people smoke around you, in your home, in your car, and try not to go to establishments that still allow smoking. Exposure to secondhand smoke causes nearly 50,000 deaths each year in the United States alone. According to the CDC, 58 million non-smoking children and adults are exposed to secondhand smoke in the United States. Approximately 25 million children and adolescents aged 3 to 19 are exposed. Risks of involuntary smoking to children. Involuntary smoking or secondhand smoke increases the severity of asthma attacks and the frequency of asthma attacks, and it can also increase the risk to develop asthma. Secondhand smoke causes acute and chronic middle ear disease, which can lead to hearing loss, which can be permanent. Secondhand smoke inhibits lung development during childhood by raising the inhaled carbon monoxide levels. Secondhand smoke increases risk for respiratory illness like bronchitis, croup, bronchiolitis, and pneumonia. SIDS risk is doubled in children who are exposed to secondhand smoke. Secondhand smoke can also increase risk of behavioral issues like ADHD, intellectual deficits, and antisocial behavior. fact, a single cigarette contains over 4,800 chemicals, 69 of which are known to cause cancer. This slide just shows a few of the cancer-causing chemicals in tobacco smoke: acetaldehyde, arsenic, benzene, cadmium, chromium, formaldehyde, nickel, vinyl chloride. Some of these chemicals are found in crude oil, gasoline, batteries. Some of them are metals. They're flammable. These are cancer-causing chemicals found in tobacco smoke. What about e-cigarettes? You may have heard e-cigarettes also called e-cigs, e-hookahs, mods, vape pens, vapes, tank systems, and electronic delivery systems. E-cigarettes produce an aerosol by heating a liquid which contains nicotine, some flavoring, and other chemicals. Users inhale that aerosol into their lungs, and anyone nearby, bystanders, they're also exposed to the aerosol as the user exhales it into the air. Are e-cigarettes safer than cigarettes in pregnancy? Well, most e-cigarettes contain nicotine, which is addictive and toxic to developing fetuses. So the answer is no. The aerosol from e-cigarettes may contain less toxic chemicals than regular cigarette smoke, but e-cigarette aerosol is not harmless. E-cigarette aerosol may contain harmful substances like nicotine, heavy metals like lead, nickel, tin, volatile compounds like gasoline, benzene, formaldehyde, and other cancer-causing chemicals. Well, what about smokeless tobacco? According to the American Cancer Society, people who use smokeless tobacco are still exposed to at least 30 cancer-causing chemicals. Tobacco-specific nitrosamines are the most harmful of these chemicals in smokeless tobacco, causing oral, esophageal, and pancreatic cancer. The higher the level, the greater the cancer risk. I have some pregnant patients who say, should I just stop or cut back? I don't want my baby to go through nicotine withdrawals. There's not a magic number of cigarettes a pregnant woman can smoke before the unborn fetus is affected. So just stop. No level is safe. Just stopping completely provides the most health benefits. This is a graph of the prevalence of maternal smoking during pregnancy in 2016 in the United States. You'll see that the smallest percentage is 2%. That's for women who are 45 years and over while they're pregnant. What are the benefits of quitting smoking to yourself? Regarding pregnancy, well, when you quit smoking, it increases your risk for becoming pregnant, helps you breathe easier, gives you more energy, reduces your risk of having a miscarriage or an ectopic pregnancy, and reduces your risk of having a premature delivery. The benefits of quitting smoking for your baby before or during pregnancy is the #1 way to effectively protect your baby from serious complications. When you stop smoking, your baby will get more oxygen, even after 1 day of not smoking. Your baby will grow better and likely to be born at a healthy weight, be more likely to feed better, be more likely to go home from the hospital with you at discharge, be less likely to have birth defects, and less likely to die from SIDS. There's instant gratification for quitters. Within 20 minutes, your heart rate and blood pressure return to within normal limits. Within 12 hours, the level of carbon monoxide in your blood decreases. In 2 to 12 weeks, your circulation improves and you can notice significant improvement in lung function. In 1 to 9 months, coughing, wheezing, shortness of breath decrease. 10 years, your risk of cancer of the mouth, throat, esophagus, bladder, cervix, and pancreas decrease. And in 15 years, your risk for heart disease will be that of someone who doesn't smoke. Now you know what benefits stopping smoking provides to both you and your unborn child. Be a successful quitter. If you don't smoke, don't start. But if you do, there are many resources available online. This slide provides some of the resources which are available, but there are many more. Talk to your doctor about smoking cessation medications, which is safe to take in pregnancy and when you're trying to achieve pregnancy. Now at this time, I'd ask that you please complete the post-test on this presentation. Thank you.